when you're talking about individualized plan, the word individualized is very, very critical. And one of the most difficult aspects of traumatic brain injury and PTS is that you and another warrior can be in the same exact incident and have two very different presentations. So the word individualized is key. That if your predominant complaint is about sleep disturbance, that'll be a driver in where we target their care. Now, if we know there's a physical injury, there'll be a parallel full assessment process of their brain functioning from what we call neurocognitive testing. There'll be MRIs perhaps ordered of their brain if we know there's been some reported concussive injury, and we'll take their word for it even if there's not a documented event. If they're talking about anger management, then sometimes we can match the present symptoms to the actual injury. If they said they hit the front of their head and they're also having some emotional dysregulation, I think there's going to be concern that there's been an impact on the frontal lobe. But we're going to target that person's individual plans because one of the first things we want to do is make them confident in the process and instill some hope, and also address some of their low-hanging fruit symptom problems. And so if it's sleep, we're going to target that, because the other thing is sometimes we'll think it's one thing, and then after 3 or 4 days of good solid rest, the person's presentation may be very different. If the anxiety comes way down as a result of getting some solid sleep, then we might be able to decipher, is it really psychological in nature, not because their anxieties come way down, but there's still this sort of point where the tires meet the road and they're not functioning quite the way they used to be. Maybe they're still irritable and they're still unable to concentrate, they're just not anxious now, which tells us maybe we're teetering a little bit towards traumatic brain injury. And so that would then take on the focus. When I say the focus, that doesn't mean the other disorders are neglected. And so usually what I would say is where there's smoke, there's fire. So if you have some symptoms, we want providers thinking about the other things. Are there pain management issues, both physical and psychological?